I came to the IAOMT after about 15 years in practice, when I realized at that point in time that you shouldn't be using mercury in dentistry. And for the first 15 years I did, just like I was taught in dental school and taught by the ADA. And the result of that was I got mercury poisoning from my job. And through the knowledge I gained through the IAOMT, I've recovered from the mercury poisoning and stopped doing mercury dentistry and now try to practice safe mercury dentistry. And by safe, I mean when I take it out, I protect myself, my team, and my patients. Well, you gotta remember, I graduated from dental school in '82, so that was even before the ADA would admit mercury was coming off these amalgams. So what they taught us is that as an amalgam aged, it corroded. And the corrosion products sealed up the amalgam. Now that is such poor science. I mean, it just doesn't happen. The corrosion they're talking about is the oxidation process that goes on in the amalgam, which releases more mercury. And the dark stains that begin to get around this stuff is like rust and the mercury being released into the tissue of the tooth. So that's what's happening, but that's not what I was taught. So I was taught that once we mixed all this mercury in with the silver and the other ingredients of amalgam, that it was safe. And they're still teaching that today. They're not really, I don't think, teaching the corrosion process anymore. And they do admit now some vapor comes off, but it's not enough to hurt you. I found out that mercury was a problem through two things that happened. One, a patient came in, and she had a Clifford test, and she was about a 65-year-old female. She looked like she was 80-something. She could barely walk. They had to drive her to the office, and she came in and told me she wanted me to take all her fillings out and put these composites in. And I argued with her like most dentists would, but I told her I would do it, so we did it. And then she had chelation therapy through a physician. Came back into my office about 6 months later, and I didn't even recognize her because she looked her age. She was walking, driving herself, spry as she could be, and it was an amazing change. Then I heard Dr. Bill Strupp. Went to one of his seminars where he was very against amalgam as a restorative material. So from that point on, I walked him back into my office and said, I am no longer going to be doing mercury fillings. And my staff said, fantastic. And we just threw it all away. We got it out of the office, and I haven't placed one since, and that was back in 1997. But even before that, my wife, around about the same time, my wife had worked for me in my first 2 years in practice. About the same time as this, she started having symptoms that all the doctors said was fibromyalgia. And this was when she was in her 30s. And I just refused to believe she had fibromyalgia because I didn't know what it was. The doctors don't know what it is. They don't know what the cause in it. They just labeled her symptoms of pain, muscle pain, tiredness, weakness, joint pain as fibromyalgia. So I sent her to an internist who treated fibromyalgia and also treated chronic pain patients. And he tested her for mercury toxicity. And what happened? She was full of it. She had gotten contaminated the 2 years she worked chairside for me. So that made me think, well, look good, if she's got mercury poisoning, maybe that's why my elbow hurts all the time, and that's why my wrist hurts all the time, and my thumb hurts all the time. And that's why I'm getting so irritable and short-tempered. So I had my test done, and I was off the charts. The way I got treated, I went to a physician who understood mercury poisoning, and it took 2 years of chelation treatment to get my mercury levels down to an acceptable level, which is below 3. That was every month. I'd get IV chelation treatments and took some drugs that pull out the mercury. And it's just, you have to go slow and pull it out slowly. Well, my symptoms were relieved immediately after about 2 months. I started seeing improvement in my health, and my symptoms went away, and my joint pain went away. And I have absolutely no symptoms now. It's great. What the IAOMT is hoping to accomplish is to make dentistry safer for patients, for team members, and for the dentists who are doing the dentistry. And the first thing to make dentistry safer is to eliminate mercury in dentistry. It's an archaic restorative material As a restorative material, it's not a good material. It expands and contracts more than the tooth. It causes cracks in the teeth. The retention that has to be cut into a tooth weakens the tooth. It's just the first step of a tooth fracturing and having to have a crown later and maybe even a root canal. We have much, much better restorative materials today that are a lot safer. We have bonded composites. We have porcelains. We can almost totally eliminate any metals in the mouth and dentistry today.